And in this circumstance, I think the application of the ridden horse pain ethogram can be useful to demonstrate, at least in numerical terms, the number of behaviours that the horse is demonstrating, which are a reflection of underlying pain-related pain. So my take-home messages are that we require an accurate history. We need to perform a comprehensive clinical assessment, but that should be performed with an open mind, with no prejudgment about what the problems may or may not be. And we need to address the obvious problems first and decide what we can and cannot realistically hope to achieve. So in the horse on the right, we can see that there is a perpendicular bisector of the pastern, which does not equally bisect the hoof capsule. If we look at the distance A, involving the lateral aspect of the hoof capsule versus distance B, we can see that A is greater than B, and we're not going to be able to alter that substantially. If we look at the photograph on the right, we can see that the lateral bulb of heel has been shunted proximally, and there is potentially something we can do about this. The foot is also not in mediolateral balance. A perpendicular bisector of the pastern region, and drawing a line perpendicular to that, we can see that that line does not touch both the medial and lateral branches of the shoe because the foot is unbalanced. This could unquestionably be improved by appropriate trimming. One key important fact is that we must localize the sources of pain through diagnostic anesthesia. And then we have to be very transparent about what can and cannot be managed successfully with respect to the optimal outcome for this horse. Some problems are easily managed, although long-term help may be required with repeated treatments and management changes. There is no doubt that the greater the number of problems that a horse has, the more challenging successful management is. We always have to bear in mind the ultimate welfare of the horse, and sometimes that doesn't coincide with what the owner desires to do with the horse, and we therefore have to try to reach a compromise solution to help both of them optimally. Many problems can be partially managed, but owner expectations may need to be reduced or an alternative job found for the horse in order to enable it to work comfortably. And in essence, that's the most important thing. Many horses can do a job, it's deciding what that job should be. If we consider the horse on the right, this horse has got proximal suspensory desmopathy in the right forelimb. The suspensory ligament is enlarged. It has loss of long linear parallel echoes in the longitudinal images, especially dorsally. And there is evidence of adhesion formation between it and the accessory ligament of the deep distal flexor tendon, indicated by this echogenic material between the two structures. And this is going to be a difficult problem to manage successfully. In addition, the horse has a concurrent injury of the medial branch of the suspensory ligament of the left hind limb. The suspensory ligament is enlarged. There's loss of long linear parallel echoes in the longitudinal image.